discuss the president's historic drug deal is Dr. Mehmet Oz, the administrator of Medicare and Medicaid Services. Dr. Oz, thank you so much for being here with us.
Batya, I like that framework, and it is remarkably accurate. And I'll just take my personal experience working with the president. I've known him for many years. I've seen him do this in other walks of life, but this most favored nation pricing that we're going to talk about today was a good example. We were told it couldn't happen. The president was undaunted, didn't care. In his first administration, he tried to do it, and he laments the fact that he got a 1/8 of 1 point benefit improvement in prices, and he thought that was a success. And he realized we just have to blow the whole system up in a way that can be reconstructed more artfully. He aligned everybody. He introduced me to the head of Pfizer early on, even before the inauguration, and said, you guys are going to be working together, get to know each other, because you have to build on that little kernel of that ember of heat between all of us and make it a real fire so we're aligned.
President Trump said something last week during shutdown negotiations, very interesting. Nobody likes Obamacare. It was reported that he said it's expensive, bad coverage. What we should do is write a new health care program. Could we see President Trump pursue something like Medicare for all?
I think the president is very thoughtful about all the different ways we can help address the challenges to the ACA. The Affordable Care Act was designed to catch people coming off Medicaid and help them get into commercial health insurance. It's unfortunately filled with lots of flaws, but there is no point talking about this program or any other ideas until we get the government back up and running. I mean, I'm sitting, in my office, but I don't have a lot of staff like we usually have, a beehive, people running around doing things to help the American people. That's vitally important because some of these programs like telehealth, for example, people live on these programs. They rely on them. When you shut the government down for political purposes, you hurt the American people. And this is the real focus, I think, right now of much of what you're hearing coming out of Washington. Why are the Democrats doing this? I don't understand it. It's literally a 7-week extension of the budget so that we can negotiate some of these other issues that they're concerned about. And I get it. They've got things that they want to get on into the bill that ultimately might get passed, but it's not going to happen this way. There is zero chance Republicans are going to bend on these themes. Keep the government open like it's happened so many times in the past. Let's, in an orderly fashion, discuss all the opportunities to help the American people, but only after we have a government that's functioning and we have people around us.
And the Democrats claim that the shutdown is about, tax credits for Americans, for vulnerable Americans, and access to health care. The Republicans say no, it's about keeping illegal migrants off of the Medicaid rolls and off of having access to government-subsidized health care. The Democrats then respond and they say, well, actually, illegal immigrants can't access Medicaid. But that's not actually exactly true, is it, Dr. Oz?
Batya, your monologue was very accurate, and unfortunately, illegal immigrants have been able to access Medicaid, but more importantly, they've been able to access Cadillac Medicaid in California, where you get dental and vision and all kinds of other benefits that aren't part of regular Medicaid programs in other states or Medicare anywhere. Right? In Medicare, older Americans who work their whole life and put money into the system, they don't get free dental unless they sign up for Medicare Advantage. So it's a weird dynamic, but states were able, like California, were able to figure out that they could pay for illegal immigrants and give them fantastic high-level service, better than most other Americans get, and get the other Americans who weren't getting those services, who are rightfully here, lawfully present, to get them to pay the bill. So when we actually got serious about this and messaged that we were no longer going to do this, and the One Big Beautiful Bill codified that, guess what happened in California? They stopped offering those services. Because it was nice to do it if it was someone else's dime. But when I'm paying, I'm not so nice anymore. And I think that's the fundamental reality. This shutdown, I believe, is purely political. The reality is the Democrats cannot possibly think we're going to revisit a bill, the One Big Beautiful Bill that we worked so hard and so thoughtfully to get through to save Medicaid, to deal with the fraud, waste, and abuse that was sinking this beautiful, wonderful program that helps so many Americans. And now that we've saved it, we are not going to retrace our steps and give up some of those safeguards to keep the program both fair and viable.
So much of what you all are doing is revolutionary in its refusal to accept, what was this calcified, accepted wisdom about the way things should work. For example, that healthcare is something only Democrats care about. But sometimes, in my view, it can go a little bit too far. You work very closely with RFK Jr. I know he was instrumental in this Pfizer deal, but he's also expressed skepticism about vaccines. He said that they cause autism, a claim that doesn't have a basis in reality. And alarmingly, in the 2024-2025 school year, vaccination rates for measles, mumps, and rubella dropped to 92%, which is well below the herd immunity requirement. These diseases maim and kill children. You're a doctor. I know you care deeply about this. Should we not be worried, or why should I not be worried about RFK Jr.'s rhetoric around vaccines?
Let me give you a metaphor, Batya. When you have children, you hear things, but you double check. You kick the tires because they're your kids. RFK Jr. is so passionate about this issue that he is embracing every little bit of information he can gather, and he's commissioned work done. Now the NIH has $50 million extra focused purely on autism grants. They've given 13 of these out to figure out what's really happening. The announcement you heard last week about leucovorin, which is a prescription medication that might address the insufficient levels of folate. Folate comes from foliage, leafy green products. That's a B9 vitamin. It's actually low in children with autism in many instances. We have a prescription medication that in about half the kids in the clinical trials has shown benefit. So the president said, we're not going to wait a day. We're going to go out there right now and tell everybody. It's sort of the same thing that's happening in the vaccine space. The president said this, by the way, in that press conference, says, I am pro-vaccine. I mean, he was the one who got the COVID vaccine out. He said Bobby is pro-vaccine, and Bobby's issues are not whether the vaccines are good or bad in one particular instance or another. It's, do we have the right schedule? And I think there's an opportunity for our nation to revisit this. Why wouldn't we want to look at whether or not 72 doses of vaccines are the right amount? And there are many other countries that give less than half that amount, and they seem to do okay. So I think the American people ought to push for a powerful revisiting of many of the assumptions we made in public health. And there has been mistakes made at the CDC. We saw a lot of them during COVID, but they were existing before COVID. Let's clean this system up. It's, as Bobby has said publicly, his father, you would tell him that change is nice, progress is nice, but it requires change, and change has enemies. And I think we're seeing that.
He seems to believe that there's been a big rise in autism. But isn't it the case that this could be simply a rise in diagnosis of autism? For example, in 2013, up to 2013, if a child was diagnosed with ADHD, that child would then not ever get an autism diagnosis. Of course, that changed. You could see how that would immediately increase the number of people being diagnosed with autism. That doesn't mean that there's more actual autism. Where are you on this question?
I think it's mixed. I think there are more diagnoses of autism, but I think we also actually have more autism. And I'll give you a concrete example. I just turned 65. I'm actually a beneficiary of the program that I now get to run. So I never knew a kid growing up who had autism. And Bobby's 71. He said the same thing. So we started looking around. Neither of us can find people our age who have the kinds of autism we're talking about. So if there was a lot of autism when we were growing up, we just were not seeing it for whatever reason, undiagnosed or institutionalized. I don't know why we wouldn't see them, but I literally never had a friend with a kid or sibling that had autism, and that's not the case now. It's hard to find a family that doesn't have a personal relationship with autism one way or another. So I do think there's an absolute increase, and there's many, many possible reasons for that. I mentioned the folate deficiency. That could be linked to autoimmune issues. We have lots of toxins in the environment, but what it doesn't, we can quibble about the numbers, but the most important thing is we should have no autism. So let's get to the root cause, and Jay Bhattacharya, who's a wonderful scientist from Stanford who's running NIH, is committed to this. He's the one, by the way, who's identifying these early signals and opening our eyes to the possibilities out there. And we've committed, and the president, again, he's very passionate about this, doesn't want a day to pass when we find a potential clue. He wants us to tell people. So we told everyone about concerns with Tylenol. And again, that's not about all Tylenol, all pregnancies, but if you have a minor issue in pregnancy, be thoughtful about the fact that you've got a baby in there, and less is more. Take as little as possible unless the doctor tells you otherwise. Leucovorin, we've got a prescription medication that I think women should be considering, and FDA is changing the label, and CMS therefore can start allowing states to pay for it. So now moms, and 53% of kids born in America, autistic or not, are insured by Medicare, Medicaid, and CHIP programs, Children's Health Insurance. So we get to pay for it, which is a good thing, because now moms aren't going to be hindered from treating their children if it's a possibility. We'll learn more about vaccines. You'll be hearing more about it, over the next few months. And there's many other things that we're concerned about. But when we know them and what we know, you will also hear.
So final question, what's next for you? You mentioned that there are some more companies that are signing up for this amazing new development on lowering the prices for average Americans. Can you name any of those names? And what's next, sort of bigger picture for a GOP healthcare agenda?
Batya, it's a diabolically clever question. I cannot tell you the names of these companies because that would definitely move their stock value. But I can tell you that these are important companies making medications that affect so many Americans that by the time we're done this whole process, I do think will have affected almost every American if they're taking a medication. And I also am confident that we're going to be able to roll out this great program called the Rural Health Transformation Program. It's the $50 billion investment in rural healthcare that's, again, massively increasing the ability to improve infrastructure of health in a part of the country that has fallen behind.
Dr. Oz, may God bless and protect you. Thank you so much.
Bless you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.